All right, everybody will probably get a prompt that pops up to continue in the meeting with that recording started. With that, thank you again for joining our March office hour session. We're happy to have Mary and Heidi with us from DHS to really share with you updates and changes related to reporting, assessment, evaluation, action planning. Again, at the end of our call today, we'll just encourage you to share your feedback in the evaluation link. And for those that might be watching the recording later, we'll also share out this recording and the feedback link, the evaluation link at the end as well, so we can be responsive to your needs. With that, Mary, I'll turn it over to you. Thank you for joining us today.
Yeah, thanks so much, Danette. Hi, everyone. If we haven't met before, my name is Mary Cush. I am our Title V evaluator and epidemiologist at DHS, and I am your go-to if you do have any questions on Alchemer reporting. I will put my email in the chat once I'm done presenting in case anyone has questions sooner. There's also my email on the website. There's lots of ways to get in contact with me, but just wanted to introduce myself for anyone that I haven't met yet. I'm going to be doing a bit of an overview on what reporting is going to look like this year within the Adolescent Wellbeing Objective. I will go ahead and share my screen. All right, is everyone seeing a Word doc with some green font and black? Awesome, sounds good. Thanks, Danette. So I'm going to give just a general overview of what things are going to look like, highlight some changes for 2024, and then go over the reporting dates for this year. And then if there's any questions, if you want to at that point unmute or throw them in the chat, feel free and we can talk them through. So generally speaking, for reporting for this year, we are still using Alchemer. The switch over from REDCap to Alchemer went really well, and I just want to thank everyone for their feedback throughout 2023. The switch was well received from the perspective of the local and tribal health agencies, and we're going to work to continue to improve on the process and hopefully make it smoother and less burdensome. So if you do have any feedback on the process, please let us know. I'm always all ears. It's a different perspective that I have than what you see on your end and how things work. So it's great to hear what's working and what could be better. For this year, you will receive a reporting link and password at the end of the first quarter. So coming up just in a couple weeks now, it'll look a lot like it did last year, where you will get a personal email from me with your reporting link and password to your survey. Similar to last year, again, you'll have 1 month for reporting each quarter. So you'll get that link sent out at the beginning of the end of the quarter, and then you'll have 1 month from that time to report. If you do ever need more time, just reach out to your contract administrator. Let them know. I can keep the surveys open. It's no big deal. So just let us know if you do need that flexibility or more time. Printable versions of the surveys will be available in case your agency would like to prepare responses offline before entering them into the survey. I'm going to be attaching those printable versions of the surveys to those emails that I send out at the end of this month, so you'll have access to those there. Okay, some changes for 2024. So as I had mentioned just a little bit ago, you will receive your reporting link and password at the end of the first quarter. Within the first quarter survey, you're going to be asked at the end of the survey for an email address where you would like your unique editable link sent to. So after you submit your quarter one survey, you will get an automatic email with this link. So it's important that you save this email, save the link, because this is what you'll use to access your reporting for quarters 2 through 4. So for quarters 2 through 4, instead of me sending out that personalized email, we're just going to send out a GovD reminding agencies that quarterly reporting is coming up and when it will be due, and remind you that you have access to that unique link from that email. If you do happen to misplace the email or the link, or say the person that it got sent to maybe moved on to another position and you don't have access anymore, just let us know. We do have access to them all on our end and we can pull that for you. Generally speaking, we've been working really hard to minimize survey lengths and reporting burden this year. So I've been going through with all of our teams who work across all the objectives, reviewing surveys and editing them based on what information we need to know versus what's nice to know. So we're really trying to pare them down, switch a lot of open response questions from last year to checkbox based on the responses that you gave us. So trying to make the reporting process a little bit less burdensome for you all. Reporting dates will look really similar to last year. So quarter 1, you'll report on activities that your agency completed from the beginning of this year, so January 1st through March 31st. And then again, you'll have a month to get that in. So reporting will be due at the end of April. And just as a reminder, even though you're reporting on your work on a quarterly basis, the information that you're sharing with us should reflect the activities that you completed from the beginning of the year to the end of the current quarter. So it is building one from the next. Your past responses from each quarter will be saved, so you can add on to and edit your responses rather than needing to re-enter information every quarter. So that first quarter will be the heaviest lift where you're getting all that information in, and then from there on out, you're just going to be adding on to or editing what you put in. And that is all I have on my end. Does anyone have any questions that are coming up that we can talk through while I'm on and live and can answer them? I will also put my email in the chat if you maybe have more specific questions to your agency and you want to reach out to me directly. You're more than welcome to.
I know there was interest in getting the PDF sooner than later, just so
Yeah,
they know what they can expect when they
I
enter
do have it available. I actually just finalized them yesterday. So if we do want to send them out sooner, Heidi, that's totally okay with me. We can figure out how we want to coordinate either have you send it out, or if it wants to, yeah, we can figure out how we want to do that so everyone can prepare. I will say a lot of the information is similar to last year. It's just in a slightly different format. So it won't be totally new information that we're asking for. All right. Not hearing any questions. I can stay until about 9:30. So if anything does come up, I can respond. But yeah, my email's in the chat. Feel free to reach out if anything comes up. And we will, yeah, figure out getting those printable versions of the surveys out to you all sooner than later. I can hand it back to you, Danette.
Great, thanks, Mary. I'll just add, I appreciate the opportunity for our team to participate in sort of a review and offer suggestions and ideas. And I think that based on what we've seen, all of our thoughts were considered in terms of maybe how to adjust the language to be reflective of that youth engagement assessment tool and other components of the work. So we were really grateful to be a part of that process and think that will benefit everyone as well. Right, we got a few people still joining. Again, feel free to put, I am watching the chat very closely. So if anyone does have questions that sort of come to the surface and you don't want to unmute, but you'd rather type them in the chat, please feel free to go ahead and do that. Otherwise, I will turn it over to Heidi to share any updates or expectations, clarifications, again, and also to take questions from all of you.
Okay, thank you. I'm glad Mary was able to join us. I am not the expert in reporting, so I appreciate all that she did to get this ready for us, and appreciate Extension's review of the tool as well to make sure that we have a good tool for capturing the work that's being done in adolescent well-being. And we are getting close, very close to the end of the quarter. So quarter 1 is ending shortly. So it's very timely. We will try to get the PDF of the quarterly reporting survey out to you. And then again, expect the email from Mary with your link for your own survey with a password. I think the only other thing on the bigger picture is that there will be a new adolescent health lead staff at some point. Maggie's position will be filled, but it is a ways out there, just so those that know remember Maggie and worked with Maggie. She has moved on, and we will have a replacement at some point, but it takes time. All right, so on to the adolescent well-being. We had one objective for 2024, and also with that, we only had one strategy. Tried to narrow it down, make it a little more easy. The objective was to collaborate with community partners, schools, healthcare, UW Extension, and other partners to implement evidence-based suicide prevention and mental health promotion programs that promote belonging and safety. So that was the objective. And then there was the core activities that you are probably all working on. The first one was to conduct outreach, recruit, and support collaborative partnerships. So that's basically knowing your community, working with your local partners, figuring out what strategy works best, look at your data, and then to make sure you're including the youth input as you work on those strategies. The next core activity was to complete the youth engagement tool, and then to implement one of the practices that from that toolkit. The youth engagement toolkit is really, most of you are probably, if you had the objective last year, this was a requirement last year as well. So hopefully it's moving you along in your local efforts. It's an evaluation tool, but it has 5 components. It's nice and simple, helps you identify strategies that you can address locally. If you look at the appendix, it gives you some great example of what it looks like in practice. And I think that's, I think you'll find that really helpful. It's not something we collect, but we do have you report on what you're working on from the toolkit. So I think you'll find it helpful. Hopefully you find the toolkit very helpful as you work with your partners. Another activity is to collaborate with your law enforcement and other partners to restrict means for suicide. You'll see all this again in your reporting. It has areas for you to check whether you've started it or whether you're just planning for it. The next one is to promote peer support resources, and it gives you some examples of ones that are already are being implemented across the state. And then the last activity, core activity, is to work with your schools to participate in the youth risk behavior survey and school health profiles. So those are the main activities under the objective. Other requirements are to attend the learning community calls. The first one was in January, and the recording is available. Hopefully you are all in the loop and have gotten the newsletters, and also if you were not able to attend, you can watch the recording of that first learning call. The next one is in April. And then the quarterly reporting in Alchemer is another requirement, and as Mary just went through, that's due 1 month after the end of the quarter. So we will be looking forward to seeing all the good work that's happening in your community. Youth engagement toolkit, you should all be looking at and working with your partners on, and then utilizing YRBS data, working with your local partners, and including youth voice in your work. Something new this year I believe was the budgets. I have most of the budgets. There's a couple that are getting revised, but appreciate those that have sent their budgets in, and I've been able to look at them. Budgets should just be the MCH funding and not include the match. And then budgets can be modified anytime during the year. If you move more than 10% between categories, we don't need to submit an amended budget. But if you move more than that between categories, work with your contract administrator so we can have the amended budget on your file. Another reminder is to copy your contract administrator on any year's monthly reports, so we can know that where you are on your spending. One of the new things for this year, again, was gotten it a couple times, was the link, it's a Smartsheet link to add staff, your contact staff. That will create a a list for us that's in real time, make sure it's up to date. One of the things that are coming is a dashboard for each county. Each agency will have their own dashboard. You can see in real time where your spending is at, as well as your current staff. So then you know if somebody is not getting emails, that's because they're not on the list. So that'll be coming shortly. You'll be getting the link, and you can then look in real time at your dashboard. So then I think it'll make sense why we need the most up-to-date contact. And you can see, I think it doesn't make sense until you see the full picture of why we're asking you to do the Smart Sheet link for contacts. So look forward to that. And then I think the last part is about health equity. Those that have been here for more than a year in the past, the community engagement assessment tool was required, and we're not doing that anymore. We have health equity still as a priority that continues to be woven into all of our work. The health equity and community engagement was an objective that could be selected. And so they have learning calls, and you guys are all invited to participate in them. The first one is April 16th from 10 to 11, hosted by Kendra Smith. I can forward that invite to everyone. It's optional. And this session will be talking about language access services topics. That's a topic that's been coming up from individual technical assistant appointments across the health departments. And then they will also have health departments present on successes and challenges. So that's what's coming up in April 16 from 10 to 11. And I will forward that invite if you guys are interested. Kendra Smith is also available for TA to all health departments. If you want her to attend office hour to share what she can offer, we could definitely invite her to a call. And then if you want individual time with Kendra for your agency, she's willing to do that as well, to have a conversation about the work you're doing, how you're incorporating health equity into your work. If you want some structured TA on doing SWOT analysis, she can do that as well. So just want to make sure that you guys are aware that health equity continues to be a priority, and that we do have a resource through Kendra Smith. I will make sure I share her contact as well for that. But just want to make sure you're aware of that. And then if there are ever any questions on your objective or the work that you're doing, please reach out to me or UW Extension. We're here to help you succeed. So we appreciate all the work you're doing. Any questions currently? There's a lot of information.